Hey, this is Dr. Paul Firnhaber. It's Wednesday and time for another edition of 10 Minutes of Truth. Today, I want to talk about an article that's really recently published in the Journal of the American Medical Association. This article actually came out in April 22nd of this year. So it's about a month ago. So it's very, very recent. The name of the article is High-Dose Vitamin D in Clinically Isolated Syndrome Typical of Multiple Sclerosis, the DLAY-MS Randomized Clinical Trial. So the objective of this study was to evaluate the efficacy of high-dose cholecalciferol vitamin D as a therapy in reducing multiple sclerosis disease activity. It was double-blind, randomized, placebo-controlled, which is the gold standard in medicine. And it was in 36 multiple sclerosis centers in France. 303 patients were randomized to receive either vitamin D2 at 100,000 IUs every 2 weeks for 2 years. Now that's about 7,000 IUs daily. And medical visits occurred at baseline, after 3, 12, and 24 months, and at relapse. At each visit, patients underwent brain and spinal cord MRI, and neurologists assessed patients' disability using the Expanded Disability Status Scale. The primary outcome measures was disease activity designed as occurrence of a relapse and or MRI activity of new lesions over a 24-month follow-up. Patients with serum vitamin D levels greater than 40 nanograms per milliliter and a history of hypercalcemia, sarcoidosis, or tuberculosis were excluded to avoid potential overdose. Now, that's kind of interesting because 40 nanograms per milliliter is not high at all. In fact, I think it's just right on the edge of low. And they were worried about potential overdose. You know, I certainly wouldn't have been. But anyway, that's interesting. So they said that female sex, obesity, smoking, Epstein-Barr virus infection, and vitamin D deficiency are risk factors for multiple sclerosis. Vitamin D deficiency is a risk factor and is associated with the risk of disease activity. And so vitamin D really modulates immune activity in the body and in the brain. So that's why they use vitamin D. Now, vitamin D was the only therapy they were using. So they weren't using vitamin D plus a drug. It was only vitamin D. Now, during the 24-month follow-up, disease activity was less frequent in the vitamin D group. It was 60% compared with 74%. So there's about a 14% difference between the two groups. All three secondary MRI outcomes reported significant differences favoring the vitamin D group versus the placebo group. So here are the conclusions of the study. Oral vitamin D, 100,000 IUs every 2 weeks, significantly reduced disease activity in clinically isolated syndrome with multiple sclerosis and early relapsing remitting multiple sclerosis. MRI activity occurrence of new and enlarged lesions on follow-up MRI scans were significantly reduced in the vitamin D group compared with the placebo group. This randomized clinical trial shows that high-dose cholecalciferol monotherapy or vitamin D therapy initiated within 90 days after diagnosis of the first symptom of multiple sclerosis strongly suggests that MS reduced disease activity significantly compared with placebo. So what they're saying here is that vitamin D works pretty well for multiple sclerosis if given within 90 days of the initial diagnosis. Patients who benefited the most from vitamin D were those without spinal cord lesions at diagnosis, with severe vitamin D deficiency, and with normal BMI at baseline. So, and I've seen people with severe vitamin D deficiency, and of course I give them pretty stout levels of vitamin D when I see that. So this is a really important and interesting study, because here we have the Journal of the American Medical Association, which is basically their goal, or their mission is to promote the science of medical care. And here we're talking about really a functional medicine type procedure and thought process with vitamin D. So if you know of people that have multiple sclerosis or have been recently diagnosed with multiple sclerosis, number one is I would get their vitamin D checked. I would see what their levels are. And then I would consider taking some fairly stout doses of vitamin D and see if that doesn't help the problem. Because this article just says that it does. They did a double-blind, randomized, placebo-controlled trial. So it's just another study showing the importance and the value of keeping vitamin D levels high and within a good range within the human body, and what it can do for people. So if you want your vitamin D levels checked, we do that here. There's plenty of places that can do it. And we just want you to be healthy and live a good life. And if you can avoid, contracting or developing multiple sclerosis, it's a good idea to keep your vitamin D high. So that's all we have for today. This is Dr. Paul Firnhaber here in Lincoln Disc and Nutrition, Lincoln, Nebraska. And if you want to get in touch with us, our number is 402-488-2220. We do very low force chiropractic. We do functional medicine here, clinical nutrition, and animal chiropractic. So please call us if you have any of those issues. We'd be happy to talk to you and try and resolve your health issues. I'll see you next week.